Today, I'm going to be answering the question, why is a massage therapist doing a trauma, grief, and loss sensitivity certification? Over the last few years, my work and the work at the clinic has definitely grown and expanded and changed. And we're starting to see more people with physical issues that are relating to more than just physical imbalances. So this year, I've decided to take on a trauma, grief, and loss sensitivity certification. But you might be wondering, why would a massage therapist do this? How is this going to look at a massage therapy clinic? So that's what I wanted to talk about and answer in today's video. If we haven't met before, my name is Catherine. I'm the founder and principal therapist of Layton Sports Massage, or LSM Clinic. And in this channel, I usually share information about how the body works and self-care tips so you can live your life and enjoy your favorite activities pain-free. But I also like to share sometimes updates about the clinic and what our plans are, and today is one of those videos. So if you'd like to learn or understand a little bit more about why I'm doing trauma certification, trauma sensitive certification, I'd love to share it with you. You may have noticed in some of our more recent videos that we are seeing that emotional experiences, life experience, traumatic experiences can end up taking up space in our body and be a factor in some of the physical aches and pains that we feel. If you'd like to learn more about that, I do have a video called The Emotional Physical Pain Spectrum that I'll link in the description below. And it talks a little bit more about that. And I'm sure I'll be doing loads of other videos about it as well. And as I started seeing this more and more in my own practice with my clients having things coming up from their past, and then when they talk about it or release it, we notice that their pain gets better, their muscles relax. Like, it's really kind of bizarre because it wasn't something that I'd really realized before, but it is something that's being discovered in the field of psychology and trauma work. There's a book called The Body Keeps the Score that talks about how trauma creates physical legacies in our body, creates legacies in the way that we hold ourselves. So I knew that if I was going to go down this road, I wanted to make sure that I had training so that I could proceed safely, right? Because that's what we do. When we realize that our work is taking a new direction, we make sure that we get the training in it so that we can serve people appropriately. And so I came across this amazing 9-month certification, which is a trauma, grief, and loss sensitivity certification for coaches. And I've started it as of this recording last week. Today is the second class. I'm so excited about it. And I wanted to talk a little bit about how we're going to be incorporating this into the clinic. So first of all, just from a very blanket statement, when you have experienced emotional trauma or physical trauma, getting in front of someone and letting them work on your muscles, sometimes creating a little bit of discomfort, can be a very vulnerable position to be in. So first and foremost, the reason that I wanted to go through this trauma certification is because I want to make sure that everyone who comes to the clinic feels safe. And the way that we're going to do that is we're going to incorporate the things that I learned throughout this 9-month certification and put things in place so that we have procedures in place if someone feels activated or triggered, so that we can communicate to people effectively if they are coming to us with traumatic experiences held in their body that might come up. We're not necessarily going to be searching them out and asking people to relive their experiences on the table. But the truth is, when we've lived through traumatic experiences, it affects and informs every aspect of our lives, and everybody experiences a little bit differently. So this is going to become a consistent across the board how we run things once I've gone through the certification and understand what we can do to make our clinic supportive and safe for everyone who walks through our doors. The other aspect of it is, I don't know if you've experienced loss, the person who's watching this video, but, I lost my mother last year. A lot of people have lost people, especially the last couple of years. And that grief and loss affects our body and affects the way that we carry ourselves and hold ourselves, and we can build up tension. So, as part of me going through the certification, the clinic is going to be offering massage therapy for grief and massage therapy for loss. This way, if you've experienced or someone you know has experienced grief and loss, you know that you're coming to a place that understands those needs and can make adjustments for it, right? I know that every massage therapist wants to help people and they want to support people. But the truth is, if you don't have this awareness and you don't have this sensitivity, it's easy to accidentally, unknowingly make people feel a little bit uncomfortable, especially if they're a bit raw and sensitive, which, to be honest, that's how you feel when you're grieving, when you're recovering from grief or loss. So one of the things that you can see going forward, or that you can expect to see in the future, is massage therapy specifically for people who've experienced grief or loss, so that we can support people physically as they go through that process. Another reason that I'm doing this trauma certification is because I want to be able to more holistically serve people whose trauma and emotional experiences in that way is an underlying cause for their physical issues. And at the end of the day, taking care of our body is a really excellent way to deeply support ourselves as we recover from traumatic life events. We all know about the stress, fight, and flight response. We all know that when we're stressed, we tense our muscles and we shorten our breathing, and we divert blood away from the skin and create overproduced cortisol. And all of that can be supported with massage. There's loads of research that talks about how massage can help stimulate the parasympathetic nervous system, stimulates the relaxation response. But if you are recovering from a traumatic life event or a series of small traumatic events over your lifetime, going to see someone who you don't know can feel really unsafe and scary. So by creating trauma-sensitive practices and protocols in the clinic, I hope to create a safe space for people who want to use massage to help themselves recover from these traumatic life events and still feel safe doing so. So I know this video was a little bit meandering because this is a new topic. This is really exciting for me. I cannot wait to start applying these things. I'm just starting the certification this month. I'm sure I'll give you more updates as it goes. But I would love to know, do you have any questions about this? Is there anything that you would specifically like to see going forward as we're offering this massage therapy for grief, massage therapy for loss, safe protocols for people who want to have massage but who have experienced trauma? Do you have questions about it? Would you like to know more? I am very excited to be talking about this topic. And so if you want to know more, if you have any questions, feel free to leave a comment below. If you know anyone who you think would be interested in this, please definitely share this video with them. And if you enjoyed it, please like it and consider subscribing so that you see the videos that we release in future and so that more people can see what we're doing. Have a fantastic day, and I look forward to seeing you in the next video. Bye.